today, Doctors Kaitlyn Schlueter and Travis Obermire from Samaritan Athletic Medicine. Go ahead and take it away, guys.
Awesome, Brian. Thank you so much. Nice to see and see names of everybody. Thank you all for joining us today. We're super excited to be able to chat with you about all the things that Samaritan Athletic Medicine offers and hopefully give you some perspective about how we can help you individually or you and teams and members of the community that have some sports medicine specific needs. So essentially, we'd like to start by just defining for you sports rehabilitation. We talk about this as a staff a lot. Sports medicine and sports rehab get slapped on stickers and signs and buildings kind of across the country. And so it's nice to know what all that encompasses, specifically here at Samaritan Athletic Medicine. And so big picture wise, when we talk about physical therapy, we thought it was relevant to put just our professional mission statement here. And I'll read it for you. It essentially says that we transform society by optimizing movement to improve the human experience. So when you take that, it's kind of a big picture idea. But essentially what we do is we take our background training in things like anatomy and physiology and use that lens to assess how you move and things that may be problematic for you, whether that's pain or something that you just can't do functionally. And then we take our experience, identify hopefully where those deficits and limitations are coming from for you specifically, and then we come up with a plan to kind of help you work through that. The sports piece comes specifically with just our training. So everyone here in our rehabilitation department is a sports certified specialist. And essentially all that means is we've just got a little bit extra education in that world. So our educational focus was predominantly in that orthopedic musculoskeletal condition standpoint. So think things like muscles, tendons, ligaments, bones. And then all of us are also residency trained in sports medicine specifically. So we took a little bit of extra time to get trained up specifically in things like emergency management of acute injuries. So think things that happen on race day, competition day, in the gym, out on a hike, out on a ride. We also have specific background in things like movement analysis based on specific sports and different movements. And we'll take some time to get into that for you today. And then sports performance and sports specific training needs comes with this training as well. So we're able to break down sports specific tasks and then build those back up for you based on the impairments and limitations that you specifically may have.
And then as I'll speak to the staff that we have on board here at the SAM. This is our team of faculty that we currently have on staff. We have two other staff members that are going to be coming on board this summer. Again, all of us are sports residency trained, and that's really what separates us from a lot of other clinicians, not just in Corvallis or the Valley, but also in the entire Pacific Northwest. Furthermore, we're all involved on faculty for teaching residents. We have a sports residency here on site, and that's a really important part of us trying to achieve a world-class care is staying abreast on the knowledge. And we all work together with other professions, athletic trainers and physicians, and really that's what encompasses sports medicine. So what does our staff specialize in? Individual care, injury management, performance. So when it comes to skilled and individualized care, that's really where our staff come on board, is our understanding of sports biomechanics. That's really an important piece to sports medicine, because if we return somebody back to sport and they're going to do the same incorrect movement pattern over and over, then they're just going to come back and see us. So sports biomechanics are a really important part of our practice on a daily basis. And then, like I said before, working as a team, whether that's working with the physicians downstairs or across the parking lot with the OSU athletic trainers or the high school athletic trainers, we all have to be on the same page, or else we're not going to be successful in managing these athletes. Yeah, and I think sure, thanks.
Yeah. So the way that we do that is with a couple services that we provide here specifically at Samaritan Athletic Medicine. The first of which is just sports rehabilitation. And we'll break each of these down here in a second. So I'll just list them out for you all first. The second thing that we do that Travis alluded to is more of that return to sport activity testing. And we do that through a couple different realms that we'll again break down for you here in a minute. We also have a concussion clinic. That is exactly what it sounds like and kind of spans the spectrum of sport-related concussions. So this is less long-standing car accident-related concussions. You know, there's multiple facets of concussion, and they can be related to various different activities, but our concussion is specifically a concussion that happened during sport in someone who's trying to get back to that same or potentially a different sport. And then our biomechanics background. So this comes with that specific sports medicine training that I alluded to at the beginning that everyone on staff here has. So we're able to host a multitude of clinics essentially where we can do things like running analyses, bike fitting, and throwing analyses. Those are the big ones that we perform the most consistently. And we'll get in and break some of these things down for you here just to give you a little bit of a taste of what something like this might look like. So the first one that we'll chat with you about is that sports rehabilitation or sports physical therapy. Really, again, like I mentioned earlier, the goal there is to identify the pain-producing structure or region in your body, and then work with you and your goals and your sport or activity-specific needs to develop a plan to get you back to what you want to be doing. And there's kind of two realms there. So the first one is non-operative rehabilitation. So there's a lot of injuries and things that come through our doors that do not require surgery to get back on your feet and back to what you want to be doing. So the process there, again, typically that first appointment, there's some sort of baseline testing done to identify regions that can improve and then chat with you about some of your sport and activity specific goals. And then we'll work with you through either a couple of weeks or a couple of months, depending on how much time we determine you need to get back to your specific activities, and work with you through that entire process and reference that baseline testing that we get on that first visit, and retest those things as we go to make sure that the plan that we have put in place is working for what you need to be doing. The other side of that is post-operative rehabilitation. So there are certain sport and activity related injuries that require surgery, and that's where our building as a whole and our sports medicine team comes in handy. We have primary care sports physicians downstairs, and we also have an operative sports med physician downstairs. And so we see a lot of their patients following surgery as well. Oftentimes we'll see them for at least 1 to 2 appointments prior to surgery, just again to get baseline testing and chat with you all as patients about potentially using crutches if you've never used crutches before, and expectations of how to manage pain on the other side of surgery, and things that if you've never been through an orthopedic surgery before, you might not have resources for. And then we'll typically take you from day 1 post-surgery all the way back to high-level activity and sport. And the timeline there just varies based on what surgery was done. So that's kind of a big picture overview of what that sports physical therapy piece would look like. The second thing that we do is the return to sport testing, and this spans a lot of different realms of activity. Essentially the goal of this testing is to assess readiness to get back to doing what you want to do. So there's a lot of criteria as far as timelines go, just for the biology of tissues getting back to what they need to do. But then there's certain things that we want to test as it relates to strength and then how you move that will make you A, safer when you get back to doing what you want to do, and then B, hopefully higher performing because we've really checked all of the boxes to get you back to those activities. So from the strength side of things, essentially what we compare to is a lot of nerdy literature that we have on hand to compare you to similar individuals based on age and the sport that you're doing, and make sure that you're performing at a level that's going to keep you safe and keep you competitive. And then also compare side to side. So oftentimes we only injure one side of the body, and so having that other side to compare to can be really important and relevant. And essentially what you'll come away with as a patient or a client is something that looks like this, right? And there's a lot of big fancy words here that will specifically talk you through if these were your numbers, but essentially it tells you how close one side is to the other based on specific movements that we select for you, relevant to your sport and your specific injury. The other thing that we look at with this testing is some of the functional movement, and this will be very specific to your sport. So for example, on the left side of your screen there, if you're more of a throwing specific athlete, we may use a functional test videoed or portrayed there. Same thing with more of a field specific athlete here, if you demand a lot of cutting or something like that for your sport. And essentially what we look at here is, again, comparing them to folks that are competing and performing in the same types of sport to make sure that you'll still be competitive. And then B, looking at the quality of the movements. So how well are you doing that? Are you hesitant to load your injured side? And then helping you come up with strategies to mitigate anything that we might see. And so we'll assess, again, safety to return to those movements, and then provide any feedback that you can take with you in your own training or potentially back to coaches that can help you kind of progress through some of these things as well. So the question then we always get is, man, that seems like really relevant information. Who can utilize some of those services? And kind of the big three are, obviously, if you're a current physical therapy client working with us as a patient, we're going to do that testing for you regardless. If you're receiving physical therapy care elsewhere at other clinics in the Corvallis area, the Willamette Valley, and Oregon as a whole, and they maybe don't have staff or faculty with this type of training background, or the video or strength assessment resources that we have here at the SAM, we're happy to serve as a consult and send you with that report to take back to that practicing physical therapist. And then they, with their training, can implement and kind of help you get back to what you want to be doing. And then bigger picture, you don't have to be in PT to get some of this strength testing and functional testing done. So really any community member that wants more of that objective information about what your strength looks like, are you safe and competitive to get back to the sport or activity that you were performing prior to your injury or the pain that you were having. And then sometimes it can just be really relevant to developing individualized training goals for any kind of just general cardiovascular training that you're doing or strength training that you're doing on your own. So those would probably be the three biggest categories that would benefit from some of that type of testing.
Yeah, we're going to dive into specifics, like what types of biomechanical analyses do we do here or do we specialize in? I'm just going to touch on a couple of these. The first one is running analysis. Essentially, somebody comes in with a running related injury, or as I'll talk to in the next slide, it might be a performance issue that they're trying to deal with. In this case, if somebody comes in with an injury, we're going to look at their mechanics and see how they're moving through space. We do this by putting them up on a treadmill and using 2D analysis where we put a video camera on the side and one on the front, and then we break down the biomechanics from there. We also do a full exam where we check their strength and do some of the testing that Kaitlyn just alluded to, and check their mobility, right? Is it something they need to be working on that's either at the gym or at home, not even out running, that's causing their injuries? So really important stuff to develop there. And then talking about an individualized running plan. Okay, if somebody's coming back from an injury, they can't just jump right back into 30 miles a week if that's where they were or more. So we just talk them through the appropriate process of progressing back to running, along with some of the other stuff we found in our exam, where that's strength, range of motion, power deficits. And then talking to them about the type of running, right? So if we have a trail runner come in here and we're trying to assess them on a treadmill, or if we're not considering the types of training that they're going to have to go do, like running up mountains and down mountains, and we only give them stuff that people are typically doing out on the road, then we might be falling short of where we need to get these athletes back to. When it comes to the running analysis, from a performance standpoint, if somebody's coming in and they don't have an injury and they just want to get faster, what does that look like? Well, they come in, we look at the same mechanics things, we'll do the same kind of eval, but we're looking at it through a different lens from the standpoint, okay, how can we get this individual faster or just make it feel better for them? Not everybody's out there to get faster, they just want it to feel better. Essentially, somebody comes in and it's $150 out of pocket. They don't use insurance because they don't have an injury, right? But if they want to come back for a follow-up, get more exercises from us, more insight. If we are working on changing their mechanics, it's really hard to change them in one visit. So we need some follow-up to make sure that they are making those changes that we set out to change. So that's kind of the nuts and bolts of, an injured runner. And then from a performance standpoint, somebody might come in and use a running analysis at our clinic. Bike fitting, this is something that I specialize in. So if somebody comes in with a bike-related injury, first thing we're going to do is an exam, then we're going to assess the fit of the bike to determine the potential cause of the pain. So whenever I'm doing a bike fit, commonly I'm adjusting things in millimeters, which isn't very much. Sometimes when somebody's a new cyclist, it might be, bigger adjustments than that. But really, we're just trying to see how we can adjust the bike from a biomechanics standpoint to take their injury away, cause less stress at wherever their injury is. And then finding out what we can do off the bike to make them a more successful cyclist. And then if we're trying to transition into a new bike, like I just had one of these last week where somebody comes in for a new bike fit, they haven't even ridden their bike yet, so just trying to adjust to get them dialed into where they need to be from a starting point. And then typically I encourage these folks to come back on an annual, semi-annual basis, because our body changes over time and our goals change over time. And that's really important for the performance side of things in bike fitting. So as somebody becomes faster on a bike, it becomes more important that their body position is correct, because that improves their aerodynamics and in turn their performance. Same idea here. Somebody comes in for a performance fit, very commonly road cyclists and triathletes. The single assessment is $150. And then if they want to come back for a follow-up for more exercises, retune their fit after a couple of weeks of cycling, just to make sure everything's dialed in, then that's going to be $250.
And then the third clinic that we have from just a movement assessment standpoint, and this is an area that I specifically specialize in as well, is throwing analysis. So very similar format. We go injury versus performance. So from an injury standpoint, big things we look at both on and off the table are components of throwing that may be limited by just how the body moves, regardless of how the person is throwing. We'll look at things like individual strength and mobility there. And we'll come up with an individualized training plan based on things like the level of sport and activity. So a throwing analysis looks very different for a little leaguer or a young softball player than it does for our high school and collegiate athletes. Also very different based on position. So the demands of folks like pitchers, and again, both baseball and softball, are very different than your infielders and your outfielders. And the way that they set up to throw is also very different. So those are components that we take into consideration as we're working back up to where they were prior to injury. And then goals, right? Is that athlete trying to get back to the same position, or based on team needs and performance demands, have they made a transition to another type of position? And what we'll do here, typically we'll have the athlete or the patient bring in either a teammate or a friend or someone who can catch, because we again will take some 2D video analysis from 3 different angles, so left side, right side, and back side, so we can get a really full picture of mechanics and how the throw is being done, to make sure that we're not intentionally overloading a component of the body that's already painful or already injured. And what you'll come away with from that visit is an understanding of kind of some low-hanging fruit and things that you can potentially take back to your specific coaching staff and let them help you incorporate some of those drills in your practice as well. And then again, very similar model from a performance standpoint. Even if you're not an athlete or have a kiddo or a teammate that has pain, we can certainly look at this through a performance lens as well, and essentially identify areas of inefficiency, right? Especially in the pitching world, velocity is super important. In the catching world, speed and reaction time is super important. And so that single assessment will be the same cost. And if you'd like to do a single assessment and a follow-up, you can do that as well. And so this has been really impactful, again, in taking back to coaching staff and giving athletes the capacity to really fine-tune some stuff, even when there's not pain on board. So structuring that in a very similar way to our running and biking clinics, just looking at a different movement.
Yeah, and unfortunately, when you're playing sports, head injuries are an unfortunate aspect of the sport that sometimes happen, and we do specialize in treating sports-related concussions. Kaitlyn alluded to this earlier, that we don't specialize in treating injuries from motor vehicle accidents and things like that, just because it's not our specialty. But we are suited to treat folks with head injuries that occur in sport. And we do that through a team-based approach using physicians, physical therapists, athletic training staff. When needed, we do even branch outside of this, whether it's an ophthalmologist or whatever the case may be. But we first do an evaluation on these folks, because they're not all treated the same, right? And they all have different schools that they're going to and different modifications that they need, because school might bother some kids, and whereas physical activity is what really bothers others. So we have to get and drill down to the specific activities that are causing symptoms in these folks, and then trying to integrate them back as safely and fast as possible.
Great. So those were really the components that we wanted to highlight about our clinic today. Our information from a name standpoint is here, and we're pretty findable on our website. But from an appointment standpoint, we listed our general clinic phone number there, and our front desk staff is fantastic and can direct you kind of the appropriate direction based on your needs. But we really wanted to leave some time today for questions. So I'm going to navigate away from this screen briefly and take a peek either in the chat, if that's an easy way for you guys to do it. Feel free to raise hands and hop on your mic as well. But if there was anything we chatted about that was unclear, or things that you want more information about, now is the time to ask.
Great presentation. I'll address the first question we have in the chat because I have kind of a follow-up. The question was, do you have experience with geriatric athletes 70 plus? And my follow-up question is, you mentioned when you were talking about the throwing program, how the approach would be different with a child than it would be for a more mature adult. But I'm wondering if that continues to be true, if the angle you would take with a geriatric athlete would be different than you would take with, say, a 25-year-old.
Yeah, we love that question, and the short answer is yes. We do have experience. That's actually a strong component of some of our sports medicine residency training that we get, is how to manage the aging athlete, is essentially what we call them in our education. And I love your nod, Brian, to the throwing clinic in that department. I actually had a gentleman, I believe he was in his late 70s, and he was still playing travel baseball, and he was dealing with some elbow pain, and we actually did a throwing analysis on him and gave him some tools to take back to his coaching staff in that department. So we definitely have different tools that we use when dealing with athletes in that population, but we are certainly equipped to handle that population as well. Yes.
I probably know several, well, I do know several people on traveling baseball teams here locally. So
there you go. You
might
know him. You might know
him. Another question. One of our guests is talking about it from the PCP perspective. You know, how do I communicate with my provider about injury? Do I have to ask for physical therapy? You know, probably things with referrals and insurance. What are some of the short answers to those questions?
Yeah, so the first question I'll address is the one about how do I communicate with my provider? If you're referring to your provider as in your primary care physician, the Samaritan requires a referral for all physical therapy. It's not necessarily the law, but we just require it because it's more likely that your insurance is going to get covered and you're not going to get stuck with a bill. So Samaritan does require that you eventually get a referral for physical therapy. With that said, most, if not all insurances, but a lot of insurances, you can come see physical therapy for an initial evaluation without that referral, and we just request that after that first visit. But it's a lot cleaner and easier if you just get the referral ahead of time, if that makes sense. And do you have to ask for physical therapy? Yeah, you can ask for it at any time, and most physicians are pretty open to that because it usually saves the healthcare facility more money, right? So you can definitely ask for that, and it is typically covered as long as there's a reason to be seen, and more than likely, if you're having pain, there is a reason.
Thanks, Travis. Do we have any more questions? I just popped out of the chat and into the attendees section. Doesn't look like anyone has their hand up unless there's someone I'm missing. But will that cover it? Oh, we have a Kelly. Kelly, go ahead and unmic yourself and ask your question.
Okay, well, it might be kind of long-winded, but so I'm kind of managing a couple chronic conditions that most of us as we get older and do a lot of events and a lot of activities have to manage. I got arthritis in the hip, and I got herniation in the low back that didn't require surgery. But I enjoy running, cycling, walking, and doing those kind of activities. How would you guys be someone that I could go to for like a program to determine, am I doing too much to kind of speed up the process of needing a hip at some point, or am I doing too much to aggravate the low back? And so at this point, I'm kind of managing it by feel. You know, I have a whole series of PT exercises. I did 6 months of physical therapy, and I'm back doing the activities, but in some cases at a very low level compared to where I was at. So that's what intrigued me, the running analysis and the bike fitting too. So yeah, that was kind of my question is, could you take me from the PT, I'm active now, and then where would I go from there to kind of have a program that doesn't hurt me, but keeps me in the game?
Yeah, I like that you're using the title of the talk in your question. I appreciate that. I think that the short answer is yes. And I love that you're being consistent with PT you've previously been prescribed. So you're already doing the right stuff. It sounds like based on some of your needs, maybe even like the one-time consult for a running analysis or a bike fit might be a great place to start. If you're still having pain, that can always be wrapped up in a physical therapy plan of care. So then insurance covers things like that. But it sounds like you're looking for kind of that bridge between, hey, like I'm capable of doing my rehab and PT on my own, and kudos to you because that's fantastic. And then maybe we can absolutely help with the performance side of things to help you manage load, right? Like timing of your runs versus timing of your bikes and making sure that your fit and your mechanics are as solid as they can be. That would absolutely be a space that we can help you fill.
Okay.
Yeah, and Kelly, the other side of that is rehab's designed to help people go from injury to pain-free, and then we kind of introduce the performance side of things, and that's where the insurance billable falls off, right? So we do have Sam Elite here, which is not the same as Sam Fit. It's a personalized program where folks work with a strength coach in the same manner as like a OSU athlete would. But that's the important take-home message is you can't do the same thing over and over and expect it to cause change, right? So you have to have a change in your physiological load, and having a strength coach on board that's highly educated after you're done seeing physical therapy. One, it keeps the program fresh for you, so you want to keep doing it. So there's nothing worse than doing the same 4 exercises for 6 months.
Right.
As you can attest,
Actually,
sure.
2 pages, but that's okay.
Yeah, there he goes.
But we do have that on site too. So we do have a bridge program where we hand folks off, and the majority of those folks are aging athletes, right?
Mhm.
Because they tend to have more of those multiple injuries and things like that.
Okay, thank you.
Yeah, that's a great point.
Yeah, great question and great responses there. It looks like Paul has his hands up. Paul, go ahead and ask your question. You may be muted. I might see if I can unmute you. All right, go ahead, Paul. Doesn't look like you're muted from my end. Oh, looks like he just put it in the chat. Any services in Albany that you offer?
Not yet. Eventually I could see us having another SAM in multiple locations, and we've been chattering about this for years. But I do think that as we start to burst from the seams of this building, which is happening, and seeing that it is a successful model, one for patients and financially for the organization, I do think we're going to see another SAM location. Albany is probably the first place that'll happen, and then probably on the coast. But it's not like it's going to happen this year, if that makes sense.
Another question in the chat. I'm practicing zone 2 cardio training, but I'm unsure if I have the BPMs correct. Do you offer a way to set me up for the future?
A true way to do, like, find out what specific zone you're in, depending on, I don't know what type of exercise you're doing, but let's just use cycling for an example, doing a threshold test of figuring out, how hard can you go, and then backing off the zones from there. There is a really scientific way of finding out what your zone 2 is, and for you to do that, you should be working with an exercise physiologist, strength coach. Those would be the folks that help you do that. That's not necessarily a physical therapy thing. We do have the knowledge to do that, and it's something that I enjoy doing, but it's just something to be better suited for an exercise physiologist to find that zone. There's also ways you can figure that out online on how to do it, whether that's a running threshold test. Even a lot of the fancy watches, like I got one here, will tell you what your zone 2 is. So if you have a Garmin watch, I'm sure some of the Apple Watches do the same thing as well, but you can find that out pretty easily just by your watch, or if you wanted to get more detailed, you could do that with an exercise physiologist for sure.
Is that all the questions we have then? Last call for questions in the chat or raising your hand. Well, if there are not, I want to thank everyone for joining us, and also thank Travis and Kaitlyn from Samaritan Athletic Medicine. Again, their information is right there, the bottom of the screen, right next to their smiling faces. Go ahead and give them a call if you'd like to set up an appointment with them. You will all get a follow-up email to this. So if you liked what you saw, in that follow-up email, there will be a link to where this presentation will live on our website, and you can share that with friends and check back on the SAM's website for more content in the future. But again, thank you all very much. We appreciate your time, appreciate all the great questions, and we hope to see you all real soon. Thanks.
Thank you, guys. Thank you, Brian, for all your coordination. We appreciate it.